This is a vlog about atopic dermatitis. Atopic dermatitis is a chronic, pruritic, inflammatory skin disease that affects anybody. Pretty much, the atopic dermatitis is associated with an elevated serum level of immunoglobulin IgE and a personal or family history of atopy, which predisposes a group of people that includes eczema, asthma, and allergic rhinitis. What are the causes? Hardness. What are the causes of atopic dermatitis? Hardness of the water, domestic water that contains calcium carbonate. The pathology of eczema lies by changes in the epidermis, including the spongiosis, epidermal edema, accompanied by lymphohistiocytic infiltrate in the dermis. It also leads to stretching and eventual rupture of the intercellular attachments with the formation of the vessels. What are the presentations of atopic dermatitis? Dry skin and severe pruritus are the cardinal signs of atopic dermatitis, but it can vary. Acute eczema is intensely pruritic with papules and vesicles with exudation and crusting. Whereas subacute or chronic lesions present as dry, scaly, or excoriated erythematous papules. There's also skin thickening from the chronic scratching, which is the lichenification, and fissuring may develop over time. What are the associated features of atopic dermatitis? They can present with cutaneous findings, so-called atopic stigmata, keratosis pilaris, palmar hyperlinearity, pityriasis alba, periorbital thickening allergic shiners, and Denny Morgan infraorbital folds, thickening or the absence of the lateral portion of the eyebrows, infraauricular and retroauricular fissuring. What are the lab findings? So up to 80% of patients with atopic dermatitis have an increased serum IgE levels, often with eosinophilia. The IgE levels tend to vary depending on the disease severity. Most patients with atopic dermatitis have a cutaneous hyperreactivity to various environmental stimuli, including exposure to food and inhalant allergens, irritants, changes in physical environment, microbial infection, and stress. What are the differentials for atopic dermatitis? Allergic or contact dermatitis. It's a localization of dermatitis to a specific skin area. The other one is seborrheic dermatitis, which is the most common diagnosis in infants. Psoriasis is another differential diagnosis. It often involves the diaper area. In contrast with the atopic dermatitis, psoriasis often involves the diaper area with well-demarcated erythematous patches with little scale in infants and also young children. The other differential, scabies. Scabies may have diffuse eruption mimicking the atopic dermatitis. The involvement of the skin folds and of the diaper area in infants, and the presence of vesicule pustules on the palms and soles suggests a diagnosis of scabies. The demonstration also of mites or eggs by skin scraping, dermoscopy, or adhesive tape test can confirm the diagnosis. What are the treatment goals? The optimal management of atopic dermatitis consists of many things. Number one is, of course, remove the exacerbating factors. Number two, patient education, hydration, and hygiene. Most experts recommend hydrating bath using mild or soap-free cleansers, followed by an emollient to prevent skin drying. Also use emollient additives. Despite the lack of high-quality studies providing evidence of benefit, bath emollient additives like liquid paraffin, oils, colloidal oatmeal are widely used. The other one is bleach bath. Dilute the bleach bath 0.005% obtained by adding 0.5 cup or 120 milliliters of 6% bleach in a full bathtub, like 40 gallons or 150 liters of lukewarm water, or 1 scant teaspoon of bleach in like a 1 gallon or 4 liters of lukewarm water have been suggestive as a therapy for atopic dermatitis to reduce the cutaneous load of Staph aureus and improve symptoms. And also use emollients and moisturizers, so no fragrance and no ceramide. So the other one is for moderate to severe eczema. Algorithm, of course, shows the use of low potency topical corticosteroids for 2 to 4 weeks. Assess it, and if worse, for children less than 6 months of age, consider short-term therapy of wet or dry bandages with emollients or topical corticosteroids. If worse, and for children more than 6 months of age, consider dapilumab. For children more than 12 years old, consider Crisabol or Crisaboli. And if better, continue with the therapy 2 to 3 times a week, and also consider referral to dermatology if need be. So also keep in mind for babies with eczema, make sure you discontinue lip gloss when kissing the baby. Use hypoallergenic soaps like Aveeno, free and clear detergent when washing clothes, Aquaphor to skin 1 to twice a day, and follow up as needed for worsening symptoms. So again, thanks for watching. Hope this basic knowledge about atopic dermatitis helps, and see you again in the next vlog.